Vezeeta is a health tech platform that aims to empower patients seeking access to healthcare with data and knowledge. We aim to be the platform of choice for patients in emerging markets who are looking to access healthcare across different verticals and obviously within the sector across different types of services as well.
Yesterday you launched Vezeeta in Kenya. Why Kenya?
Kenya is an incredibly important market in the East Africa region from the perspective of just technology. So we know Kenya famously, globally, for the work that's been done here in leading the fintech revolution and seeing certain things like mobile money, which are now trending across the globe, having really taken root and started and taking root here in Kenya, like M-Pesa. For Vezeeta, Kenya is an incredibly populous nation with a number of sort of opportunities. So number one, there's a very healthy internet penetration across the country. Number two, there's a very strong sense of smartphone usage within the country. And then and that's on the technology side. More importantly, on the health side, we know that healthcare in Kenya can be quite costly. We also know that the ratio of available doctors to patients is also one that's an area that the government is working on improving. And we believe very strongly that given the confluence of these two factors, the popularity of technology as a really tech-forward country coupled with the healthcare needs, our platform presents opportunities that could help take advantage of the technological strengths of the population while helping to address some of the gaps and challenges that the government is looking to solve for the Kenyan population.
What can someone expect when they log on to the platform?
First of all, we pride ourselves on being a patient-centric enterprise. So a lot of applications or a lot of health tech platforms are geared more towards hospitals. We do this primarily from a patient's perspective. And so the first thing anybody can expect when you log onto Vezeeta is a very user-friendly product, a very user-friendly interface, which makes the ability to search and find a doctor according to the specialty completely frictionless. So the first thing they can expect is a frictionless experience. Next, they should expect to find about 600 plus doctors that are available to them in Nairobi, in Western and Nyanza, on the coastal regions, that they can access according to their specialties. They will have the opportunity to review these doctors based on the experiences of previous patients. They'll be able to assess whether the wait time that it takes to see the doctor is something that they would be willing to sort of endure given their day-to-day schedule. They'll also be able to know what it's going to cost them to get that consultation with that doctor. And sort of all of these things empower them to make decisions that will support them to have a positive experience and a positive outcome for their healthcare journey, either for themselves or for their loved ones and their family.
You've only mentioned 3 or 4 counties. Does that mean that it's not countrywide?
We have 2 products that we've launched in Kenya. There are several other products for Vezeeta that have been launched in other countries, which we will, depending on local appetite, market size, consider to launch in one way or the other within Kenya. But we've launched first with our consultation product, which comes in the remote form, i.e. via telemedicine or in-person appointment booking. And for the in-person appointment booking, yes, we are starting out in these 4 counties, Nairobi being where we have our heaviest presence as we look to expand. For the remote product, however, these doctors that are on the remote platform are accessible from any part of the 47 counties in Kenya, as long as you have a phone and are able and willing to call either our call center or directly access the product through the application. So if you don't have a smartphone, yes, if you call in through our call center, we can help you essentially figure out how to get access to a doctor that you want to speak to. But our telehealth product at the moment facilitates both video and voice And so individuals who log onto the application or go onto the web page can schedule the appointment so that when the time comes, they're able to do this, have this call through either video-led conversation, consultation, or just a voice consultation.
In Kenya, we've been faced with many challenges in the health sector, one being exportation of patients and being charged exorbitant prices. Are you looking at solving this while connecting doctors from outside countries with patients who are in the country?
So I think that one of the things that I'll taking a step back and address on this piece is that we all know that technology does a wonderful job of breaking down barriers. From our perspective, we think and have seen technology solve a number of problems, obviously access being a really important one, and also through transparency, sometimes driving down costs. We know that medical tourism is a growing issue across different African countries, and sometimes due to mostly a lack of knowledge. There may be specialists who exist in that country that may be able to solve the problem, but due to a lack of knowledge due to certain perceptions that people have, they may believe that the only way that they can get that solved is by going outside. And the next level, obviously, is how certain are you of the kind of care you're going to be receiving outside, wherever you're going, and how certain can you be that it will solve your problem and that doctor over there is actually licensed. I know that the government does a very good job of trying to ensure that people undertaking medical tourism are doing so with vetted providers before doing that, but there are still some, I'm sure, that are able to do this without doing it. On the Vezeeta end, we believe that ultimately, through conversations with the authorities and local authorities, that we can help begin to address this problem. Globally, we have about 31,000 doctors in Egypt, in Saudi Arabia, in Jordan, in Lebanon, whom we vetted as licensed practitioners within their areas and fields of specialty. In Kenya, currently we have 600 plus doctors. We see, even already, people booking appointments from Uganda, from Rwanda, from Burundi, and people booking appointments on behalf of their relatives in Kenya, but they're booking the appointments for their relatives from Australia, from Canada, and elsewhere. This is the power of technology. And if we think through how we can harness that to, for example, ensure that if there's a type of specialty that is either not widely available in Kenya, which we can validate based on our research and signing up of doctors, that if we can help bring that kind of care either remotely or ensuring that a person can access it in person by traveling to a particular country with licensed, approved providers who have a history, whom we vetted, who other patients have reviewed, this reduces the possibility of predatory practices that some patients who embark on medical tourism face. And so we have the capability to solve that problem. We're looking forward to engaging with the government to figure out what makes the most sense in terms of how to proceed here, and also with the Kenya Medical Association and all of this, because we have the assets, but it will obviously be a little bit forward of us to just deploy them without anybody's consent and ensuring that it meets the need of the local context here in Kenya.
So what you're saying is that through the app, we might also be able to get rid of the quacks that have invaded the
That
industry.
is a primary aim, because by being transparent and having very, very clear standards that have to be met before a doctor is signed up and registered on the application, you eliminate or you virtually eliminate the practice of quacks, people being exposed to quacks. Because on Vezeeta, for example, we have a very strict set of documents that need to be submitted by the doctor or on behalf of the doctor by the hospitals that are joining prior to enlisting a doctor. So their licensure must be intact. We need to know if they own a clinic that they have a business license to operate that clinic. If they have additional specializations that the doctor has achieved over time, we require those certificates so that everything is validated before and obviously in the picture of the doctor, so that we know who it is that we are enlisting, and the patients also know who it is that you should expect to see when they show up in the consultation room. So everything is validated for the benefit of the patient, to empower the patient to make the right choices, and to obviously also hold the doctors accountable, because they know now that their profile is out there. They are already certified professionals. Now they have an even higher incentive to ensure that they deliver a quality service to the patient who shows up in their office or their consultation room.
How much does it cost for me to register in the platform? And if I move from one doctor to the next, can the next doctor find my medical records through the platform?
Currently, it costs the patient nothing to log onto the platform and book an in-person consultation. The consultation fees when the patient shows up at the hospital, however, are whatever the doctor stipulates them to be. We do not regulate what the doctor needs to charge to the patient for their consultation. For the telehealth option, we do require patients to pay prior to the consultation being initiated. And on that front also, the doctor determines what that cost is going to be. We are integrated with a payment partner called Bionic, and through them, patients are able to make a seamless payment via M-Pesa and log onto the platform and have their consultation. As far as the medical records and medical history piece goes, this is a part that we're working on. But currently, most of the time what we see is patients will continue with the same specialist, because majority of the doctors we have on our platform are specialists, to ensure that there's that continuity as far as records go, and so forth. As far as cross-provider records, etc., this is an area that we are looking into and exploring how best to support patients with that continuity of data. We want to make this experience with the patients as interactive and as localized as possible, because there's no point in talking about expanding access if that access can only be done or restricted to people who speak a certain type of language. And so this is something that we're working on very feverishly, because we believe very much in the ability to expand access to people no matter what language or tongue they speak, and working within the markets that we're in to ensure that comes to fruition.
Can you download it on any smartphone?
It's iOS and or Android. And also, if you do not have a smartphone, or if you prefer, you can call the Vezeeta call center, and somebody in the call center will help book an appointment for you and make sure you receive a notification of that appointment, especially if it's in person, so that you can attend that appointment in clinic. If you would prefer to speak to somebody at the Vezeeta call center, you can dial 0730 632 000.
As we finish up, maybe you can tell us what patients out there should expect, as well as doctors.
For patients, expect and hold us to a seamless experience when you log onto the application to find a doctor. We welcome your feedback and your input on your experience with the product, as well as within the doctor's offices. We engage with our doctors consistently to ensure that the standards that we have both agreed on are being met with every single visit, and where it can't be for legitimate reasons, that we work to continue to find a position or a situation where the patient can have that experience. Patients can expect, for example, reminders for their appointments. They can expect notifications if a doctor can no longer make the appointment. They can expect to contact our call center to be rescheduled. We want to do everything that we can in our power to ensure that they have a seamless, frictionless experience on the Vezeeta application, because they are the reason why we built that application. For our physicians, we encourage those who have not yet sort of signed on to give the platform a try. It costs them nothing, and we only will essentially, it'll only cost them something when we actually deliver on our promise. We expect to continue to grow the number of physicians on the platform over time, and through that be able to meet the expected needs and expectations of patients in the market. And we want to have a deep partnership with doctors and the bodies that regulate doctors and other health specialists in this country. So this is only the initial stages of what we're doing. Physicians can expect more engagement at a deeper level with Vezeeta over the course of their time on their platform as we learn more about the market, learn more about their needs and how we can support them to reach more patients and how we can get patients to access them.